Now to your Capitol Watch. For the second year in a row, the state of Colorado is facing a major budget deficit next year. And one of the things facing cuts is Medicaid. Governor Polis says the cuts are necessary to balance the budget. News 5's Liv Wood spoke with three moms who are already feeling the impacts of previous cuts the state made this year and say any more cuts to their children's health care would be devastating.
Nearly a third of Colorado's general fund goes to the Department of Healthcare Policy and Financing, which is in charge of our state's Medicaid program. In a new proposed budget by the governor, he says that continuing to increase funding for Medicaid would be unsustainable. I spoke to three mothers who say that the cuts to funding in Medicaid would not only impact their children's lives, but would also impact theirs.
When you have someone who needs care 24/7 and you have to be alert, like you can't just he's not just oversight.
I don't have that extra energy to put on anything else but what is happening with my son.
It's difficult to explain and to describe the constant stress of managing everything, not just the physical care, but everything else.
Three mothers united by the 24/7 care needed for their adult children.
Nobody really knows what goes on inside my home and the heartbreak that I deal with every day. The heartbreak of knowing that my child will never have a normal life.
They say cuts to their health care from Colorado's Medicaid program have already begun.
My daughter has medically qualified for skilled nursing for 11 years, and we heard last month that all of her skilled nursing was completely denied.
But that isn't the only change. Cindy says without skilled nursing, she would have to hire a CNA using different Medicaid funding called a DD waiver. But it's easier said than done.
So on the DD waiver, you cannot have a CNA. They're saying CNA level care is embedded in the daily rate. The daily rate for 24/7 care is not close to minimum wage. And we're not asking for more. We're saying we'll do the hard work for what you're giving us, even though it is an underfunded waiver. But don't cut more. Like, we're all just in survival mode.
In the 2026-2027 budget, Governor Polis proposes changes to slow Medicaid's growth rate. He says more people are qualifying and are using more services than in previous years. In fact, over the past 10 years, Medicaid costs have increased nearly 9% every year in our state. The proposed change for the next year would increase funding by 5.6%, rather than the projected growth of nearly 12%. But we're still talking millions of dollars.
Come live a week in our lives, like come stay for a week and see what it takes to take care of these kids.
It doesn't get any easier. It doesn't get any easier. When you have a child who we're going to get through this phase, there's light at the end of that tunnel. There's no light at the end of the tunnel. We are where we are.
For these women, caretaking isn't just a 9-to-5 job. It's their whole lives.
It's like our worlds just get smaller and smaller the more you take away from the support.
There isn't a specific date that the budget has to be approved, but any requests for change have to be submitted and finalized by January 2nd. The budget itself will start on July 1st, 2026. In Colorado Springs, Liv Wood, News 5.
Liv, thank you. Continuing our coverage tonight, Governor Polis blames the federal Big Beautiful Bill Act for those Medicaid cuts. Senior reporter Megan Glova is in studio to break down what will change for Health First Colorado recipients. Megan.
Diane, Medicaid coverage and eligibility seems to be what would impact the most people in Colorado under the Big Beautiful Bill Act. For example, adult recipients will face eligibility checks every 6 months instead of once a year. That not only means more paperwork, but a greater risk of people losing coverage if they miss those more frequent deadlines or if they're found ineligible altogether. About 377,000 members will have their eligibility assessed more frequently. The BBB Act also adds new community engagement requirements. This includes work, volunteering, or training hours to keep Medicaid coverage. Certain groups are exempt, including those over the age of 64 or under 19, people who are medically frail, and those caring for a disabled child, to name a few. This would also impact about 377,000 members here in Colorado. And keep in mind, each of these changes do take effect January 1st, 2027. In studio, Megan Glova, News 5.